People sometimes ask how is doing or how is operating on I should say, South Asian or Indian nose, and this can in some ways be somewhat comparable to doing a Persian nose, for instance. And some of the overarching characteristics is that the nasal tip is, generally speaking, downward pointed and very underprojected. There is not enough tissue, or at least I should say the tissue is sparse in that area, whereas there's too much tissue on the dorsum because there's often a dorsal hump. And in terms of doing the operations, this is pattern recognition. You have to be able to understand what it needs to look like in order to be able to understand what needs to be done. Goals are fairly different. Some people come in and they say they simply just don't want the big hump on their nose. Other people come in and they want very fine, detailed, sort of porcelain-like detailed noses that and depending on the patient's anatomy, the thickness of the skin, that can be achieved. But the overarching issues with both, I would say, South Asian or Indian and Persian noses is that the tip is, generally speaking, fairly short on tissue, and you need more projection of the tip. And then alternatively, the dorsum has too much and it needs to be reduced.